Hello, everybody. Welcome to another episode of Sex with Ashley. I'm Sex with Ashley. And today we are talking about a very good topic that I didn't know was a thing, or I knew it was a thing, but I didn't know it was as prevalent of a thing that until I saw this not tweet, this thread on Threads. And I was like, no, this would be a good podcast topic. And so I invite Dr. Janelle Frederick.
I'm a pelvic floor physical therapist, but my handle on Instagram and TikTok is Vagina Rehab Doctor.
Topic.
Sure. So first, Ashley, thanks for having me. I've been following you for several years now, and
We
I
met
love.
in person, what, 2 years ago?
Yeah, we met in person, and was it?
It was two
I
years
forgot
ago.
what the venue was for.
It was in Ohio.
The More Life retreat, yes, in Ohio, which was specifically for Black women. That was amazing. But so I'm a pelvic floor physical therapist, and what that means is we help women and people of all genders recover from pelvic floor dysfunction. Pelvic floor dysfunction shows up in all areas of our life when it comes to using the bathroom. If you're constipated, you may not know that the muscles that surround your anus could be too tight or uncoordinated. So if your muscles are tensing when they should be letting go, that can lead to constipation. So we work with that. We work with urinary incontinence, which is probably the most common form of pelvic floor dysfunction. If you've had a baby, or even if you have not had a baby, you may leak a little pee when you sneeze, cough, run, jump, or laugh. That's stress incontinence, and usually due to pelvic floor muscle dysfunction, not necessarily weakness. It could be tightness causing the leakage. I personally deal a lot with sexual pain and inability to have intercourse due to vaginismus. And then also what we're talking about today, prolapse. So, that's when the organs start to droop down and it can start to protrude through the vaginal opening, the anus, or the urethra, which is the pee hole. And so we can help with just recovering the pelvic floor, decreasing symptoms. And if the prolapse is low level enough, we can even help sort of reverse the prolapse. So that's what I do as a pelvic floor physical therapist.
MD. I think it's JJ Fitzgerald, MD. Okay.
Yeah.
She said, if I never see another woman who lived with her stage four, I didn't know that even was stages, okay? Stage four vaginal prolapse for 25 years because she was too scared, embarrassed, or worried to come in again. To come in again will have done my job out here on the internet. It's insane. Millennial women, repeat after me. We are not letting our vaginas fall out and just living with it like our grandmothers do. And I was like, say what now? Like, say what? So, and in all the comments, right, are like, wait, this is a thing? Like, what is this? This is common? And like what? All the people are like, what the fuck you mean our vaginas falling out? This is what the comment, like, we was like, wait, what? So I don't think that, and I was talking this on another episode, like, I don't think that our grandmothers, mothers, aunties do a good job of letting us know what's to come with age. I do remember that my grandma passed away when I was like 25, 26, somewhere around there. But I remember she had a prolapse. I remember that. I remember she's saying she went to the doctor or something, and the one time about doctors said something to her about it. But I was in my early 20s. I didn't really know what that was. I heard it, but I was like, it didn't really register with me.
Yeah.
Yeah. And so, but like, so this is the thing. So first of all, explain what prolapse is and how it occurs. Let's just talk about the basics first.
Yeah. So we have three primary pelvic organs in the pelvis: the rectum, which is what holds our poop before we let it come into the toilet; the bladder, which obviously holds our urine before it's time to pee; and then the uterus, which houses a baby. And so those organs all lead to tubes. The vagina is a tube, the anus is not necessarily a tube, but and then the bladder used to the urethra. So there are all these openings, and the pelvic floor is this muscular structure with ligaments, muscles, everything that sort of suspends everything up. Because if you've ever thought about it, it's like, well, what's stopping our organs from just sort of protruding out? It's the pelvic floor muscles that hold everything up, with not just muscles, ligaments, fascia, everything. There's a few things that can weaken that pelvic floor structure.
Okay.
Childbirth, obviously. There's a lot of pushing and straining to get the baby out, and just being pregnant. I mean, holding all that water weight, the weight of the baby, the placenta. So all of that pressure going down on the pelvic floor can lead to pelvic floor muscle weakening. There's also things just like women who are constantly coughing. Maybe you have lung issues, and so there's a lot of pressure going down because of that. Chronic constipation. See, we don't talk about our poop a lot either, and like our bowel health. So if you're always straining every time you have to have a bowel movement, you're just applying more pressure downward. So these are some of the common causes or contributing factors. I don't want to say cause, because some women don't do any of that and they still get prolapse. So you can have prolapse before baby, etc. The prolapse itself is when one of the organs starts protruding downward towards the opening. So you shouldn't be seeing like your cervix. The rectum shouldn't be seen. But when it starts protruding out, you may see like a bulge at your vaginal opening, and that's probably one of the organs. Uterocele is when the uterus comes through the vagina. Rectocele is when the rectum starts coming through the vagina. And then there's the bladder, cystocele. So there's so many types of prolapses, but this is another reason why we should be looking down there, doing your vulva checks, and also going to the doctor. If you're feeling like heaviness or extra pressure, or if you feel like you have a bulge in your vagina, that could be prolapse. And so pelvic floor therapy would be the first line treatment to try before you even start thinking about surgery or anything else.
I was getting ready to ask, and so you kind of touched on this. So, but like, what's the most common symptoms? So, how would someone know? So, let's say someone doesn't look down there
Yeah.
often. So, how
Yeah.
would they know without looking? How would they know that okay, maybe something's happening here? I should go see a doctor.
Sure. So the first thing is sometimes you just don't feel anything. So a lot of people live symptom free and they actually have a prolapse. But
Okay.
in terms of actually having prolapse symptoms, I would say three major ones: heaviness and pressure. You just feel like a lot of heaviness in the vagina, like something is just pushing down on the vagina. Number two is feeling like there's something in the vagina, like there's a ball or a bulge in the vagina. And then number three would just be actually feeling it. Like, let's say you're taking a shower and you're washing down there and you feel something in the vagina, you're like, what's that? So those are signs, but again, you probably may not even have some of those signs if it's like a level 1 or 2. Sometimes even with stage 3, you don't have those symptoms. So asking your OBGYN to just screen you for a prolapse, paying attention when you do look down there, could be very helpful to prevent it from getting worse.
So if I'm someone who goes to get my pap smear regularly, so at a pap, could they be able to tell, oh, you're stage 1, 2? Could they tell that at a pap smear or no?
Stage 1 and 2, unless they're actually doing a prolapse screen to specifically look for a prolapse, they're probably not going to see that, especially because they're not looking for that. They're looking at your cervix for a pap smear. So that's why I say, especially if you've had a kid, I mean, I think you should be saying, hey, can I get screened for a prolapse? And if you're having symptoms, you definitely need to be using that specific language so they know what they're looking for.
It's assumed. And so what does a prolapse screening consist of? Because I just assume this is my ignorance, right? So I just assume, I'm spread eagle, so that way you're looking for all the things that's happening down there.
Yeah, that would be nice if women's health was like that, but it's not. Many women go several years, they have prolapse, and then they've never been told. So what I would say is, the question was, what is a prolapse screen? One of the common ways is you're laying on the table, just like any other pelvic exam, and they spread the labia open so they can clearly see, and they ask you to bear down, like to push out. Now, when you push out, like you're trying to have a bowel movement, there shouldn't be anything coming out of the vagina or the anus. And if we're seeing tissue start to protrude outward, then we can grade the level of the prolapse depending on how far it descends. Now, if something comes completely out of the vagina, that's a stage 5 and you need surgery, and that's the only thing that can take it back inside. And so that's what a prolapse screen would look like.
Okay, so if you're listening to this, right? And so is there a certain age you should get these screenings? I know like with breast cancer screenings like 40 and colonoscopy like 45. So is there like a certain age too you should be doing these?
There's no established age. Like there's an established age for a pap smear.
Yes.
There's no established age, but what I would say is as soon as you start doing your pap smears, you might as well. And then if you have some of the risk factors, if you've had a baby, if you have chronic constipation, if you have, pressure, heaviness down there, you definitely need to be asking them, can you just let me know if I'm at risk for prolapse, or can you check to see if I have a low stage 1? It's not like it's not a life altering thing if it's low level, but if you can see it, it can definitely impact your body image, your sexual confidence. A lot of women are scared to have sex because they think sex is going to make it worse. And so it really is important to discuss, especially because 50% of women that have given birth actually have prolapse. 50%. So that's a lot of women and vagina CEOs living with prolapse.
So yeah, that's a lot. If you're listening to this, definitely if you're someone who has given birth vaginally or just someone who's just of age, when you get your pap smear, I'm going to ask that now. When I go get my pap, I'm going to ask my doctor to do a prolapse because like I said, I just assumed that you down here, so you're looking at all the things, but clearly not. So back to sex though. So I know, like I said, I have some people who have had issues with prolapse, and they're trying to figure out how to have sex with one.
Mm-hmm.
So, what is your advice? So, one, does a prolapse affects people's sex life? One, and then two, is there things that women can do to if it does affect their sex life? Is there things they can do so they can have still enjoyable sex with a
Yeah.
prolapse?
So I'm going to answer that in two ways. If it's like a severe prolapse to the point where it's protruding past the vaginal opening. So if, let's say, the rectum is protruding through the vagina, you're not actually seeing the rectum itself because there is a wall between the vagina and the rectum, but the posterior vaginal wall that separates the vagina from the rectum will be sort of protruding down and out. So if you're seeing like tissue come out and it's past that opening, like it's past this point, that means that your partner can probably see it. And so because of that, it may be impacting the way you show up. You may feel a little bit more insecure. But in terms of sex making prolapse worse, it actually does not. Like, we have no research or no evidence to prove that intimacy, sex, penetration worsens prolapse. So that's the first thing. I know that may be hard to believe because in your mind, you don't want to make it worse. Like, you don't want it to protrude out further. But that's not what causes prolapse, right? So sex doesn't do that. In fact, sex is good for the pelvic floor and it's good for your pelvis. If it's beyond the opening and completely out of the body, you're probably looking to get surgical support for that, right? And so that can completely, lift it back up. But if it's like a level 1, 2, 3, pelvic floor therapy can help strengthen, decrease the symptoms, and even decrease the amount that it's protruding outward. So those are some things that you can do. I would say if you have a prolapse, sometimes just pushing it back up, like right before you have sex, women do that because they can feel it sort of protruding out and you can sort of push things back up in. That's one thing. Obviously, that's not forever, but if you just want to do it, right before you begin with penetration, that's one thing. Sex positions that are like not anti gravity. So like if you're letting gravity help keep things in, like missionary, your legs are up and your pelvis is facing up. So it's actually going to help keep things in. Yes, maybe if you're in cowgirl, you may feel things sort of protruding down a little bit more.
Okay.
So play with the positions, but honestly, listen, if you're having sex with a man, they probably don't care. They're just happy to be in there. So usually it's us that feels more insecure. But in terms of the worsening of prolapse, it's really not a thing for sex.
To know. So, what are some preventative measures, if any, that women can do to prevent prolapse from occurring?
Okay. So, believe it or not, prolapse prevention is not a thing. We see some of the healthiest women. I mean, women that exercise, women that are strong. And it could be that their genetics have contributed to their tissue strength. And maybe they just had a traumatic birth and they were straining and pushing for a long time. So just the terminology, I'm not saying we can't decrease our risk, but we can't say, oh, you could have prevented it if you did A, B, and C. So that's the first thing. But after that, we can decrease our risk for prolapse by one, making sure that we have healthy bowel habits. So when you have to go to the bathroom, we shouldn't actually have to push our poop out. Naturally, your poop should come on it. You get the urge, you sit down, and you let go. Now, maybe you may start it a little bit with a little push to just get things going, but you shouldn't be sitting on top of the toilet, like straining your life away. That's not good for your pelvic floor, right? So that's one thing, is eat more fiber, like get those foods in that's going to help move things through your system for you, staying hydrated. Doing core exercises. So exercises that strengthen the abdominal wall, that strengthen your butt. And those are the same exercises that strengthen the pelvic floor. So I know like 10, 15 years ago, we thought only Kegels would strengthen the pelvic floor. But, that's really not how the pelvic floor works. It works with other muscles. So unless you're just doing a Kegel to squeeze somebody that's inside your coochie, then it's not functional Kegels are not very functional. You don't really just squeeze one muscle like that. So core exercises is a big one. The other thing is like when you're giving birth, listening to when your body tells you to push, as opposed to when the doctors, the nurses, anybody else may be telling you to push. So we have a reflex in our body that actually helps push the baby out. And so as long as you are not feeling rushed, not feeling stressed, you have privacy when you're giving birth, you should be able to feel when your body is telling you to push. And that way you're letting your body work with you and sort of instead of like straining and pushing unnecessarily. The other thing is having a strong immune system. So if you're always getting sick, that means you're always going to be sneezing and coughing, which when you cough and sneeze, it's a lot of pressure going down. I mean, you can feel it. If you're on your period and you sneeze or cough, you feel that clot come right on out. So, yeah, exactly. It's the same exact thing, even though you're not on your period. That's a lot of pressure down there. So limiting like the amount of times you're getting sick can limit the amount of pressure and stress on the pelvic floor because you're not doing all that coughing, sneezing, etc. I would say those are the biggest things. And then, hey, sometimes we just get prolapse. Give yourself grace if you do. You're not broken. You know, you can still get stronger down there. You can still have amazing sex. But those are some of the ways that, you know, we can decrease our risk.
So for those people who do have prolapse, I know you talked about some treatment options before with pelvic floor therapy, but what are all the options that people can outside of surgery? Because surgery is like the very last option you want people to use, right?
Yeah, it's the very last. Yeah.
Okay. So what other treatment options are available before you get to the surgery part?
Sure. So one of them is just doing some of those lifestyle changes that we just talked about, right? No more straining to poop. Like that's done with, especially if you have prolapse. Because
Okay.
imagine that that's just the prolapse going out, you know, further. So that's one thing. Get up off the toilet, hon. If it's not coming out, go drink something warm, go on a walk, come back. It will come out when it's ready. Well, hopefully, or maybe you need some, you know, support, laxative, whatever. The other thing after just those lifestyle modifications that we talked about would be actually working with someone to strengthen the muscles that surround the pelvic floor and that work with the pelvic floor. Even if it may not be pelvic floor therapy, the muscles are, listen, your thigh muscles, your butt muscles, your abs, and making sure that you're managing pressure. So like if you're holding your breath when you lift weights, that's actually exerting more pressure. When you squat and stuff, you should be breathing out, which actually decreases the amount of pressure on your pelvic floor. So that's one thing is like training, strengthening. And then I would highly recommend, obviously I'm biased, pelvic floor therapy. And so that's when you're working with a pelvic floor therapist to assess your pelvic floor. They can help you figure out how low level or high level the prolapse is. And then we're creating a plan to actually address whether your pelvic floor is weak, tight, both, painful, etc., with exercises and different techniques to help manage that.
A question. So once you have a prolapse, can you like revert it and not have it anymore? Or once you have it, you always gonna have it. You make sure you're not get worse.
Okay, so here's the thing. I'm gonna give my honest opinion on this because I'm seeing a lot of women that claim they had prolapse at one point and they completely reversed it.
Okay.
They also selling something that's about prolapse. What I have learned as a pelvic floor therapist is that our goal is not generally to reverse it. We're not generally going to take something that's sort of protruding out and then lift it all the way back up in the body. What we try and do is make sure that we've helped you with pressure management. We already talked about that a little bit. Making sure you're not holding your breath during certain times or bearing down when you shouldn't be. The other thing is we want to decrease the symptoms so that you're functional, right? So that means like if, hey, you're not having sex because it feels very heavy, like there's a lot of pressure and that's distracting you during sex. Or maybe you are trying to lift weights and you don't know how to do it without feeling like you're making your prolapse work. So we want to actually help you do everything you need to do in your daily life and decrease the symptoms, whether it's the pressure, the bulge, the pain. We want to decrease the symptoms. Stage 1 and 2 are the easiest to decrease and possibly reverse.
Okay.
Stage 3 and 4, 5, that's generally not going to go from down there to up there.
Okay.
Okay. Usually stage 4 and 5 is when like surgery becomes an option.
Okay.
But if it's not all the way out the body, I would definitely at least do pelvic floor therapy first to learn how to not make it worse. Even if you did get surgery, you still want to know how to take care of that part of your body. So those are the steps, and then the treatment options available. Oh, there's also pessaries.
What's
It's
that?
like a thing that goes inside. So some women, of course, depending on how bad the prolapse is, if they have a smaller prolapse, this is something that goes inside the vagina. And it just rests inside. So, like, let's say this is the vagina. It goes inside and it sits here. So it prevents your prolapse from protruding out. You're not going to feel as much of the pressure. Similar to like a menstrual cup. Once it's inside, you shouldn't really even be feeling it.
Okay.
If you're sexually active, obviously you take it out before you have sex.
Okay.
But these can stay in for several weeks, actually.
Okay. And that's a
That's a pessary. So imagine someone having a stage 4 or 5 and their bladder is like completely almost protruding out. So we need to see something big enough to go in. And you have to usually go to like a urogynecology clinic to get them to insert this for you. But they'll insert it in and then they'll open up. Yeah. I know it looks big, but we're all different. We're like, let's say women have a lot of laxity or looseness, or let's say the prolapse is pretty advanced, then you have to get fitted for a pessary,
okay.
usually in a urogynecology or urologist office.
Okay.
Yeah.
Hmm.
I know you're looking at it like, whoa.
Yeah, I was like, that thing is huge. It looks big as my head, but the vagina does stretch. So, question. So, for women who may have prolapse and are feeling like embarrassed by it or ashamed, what tips do you have for them, so they can maybe feel better about themselves?
Yeah, one I would say is let yourself feel those feelings, because it's frustrating. I mean, I struggle with like fertility stuff, PCOS. I don't think I'll ever be like, girl, I don't even care. Or, I don't care. I just got this. Right. So let yourself feel those emotions, but also that emotion can coexist with like a more empowering outlook, which I believe is one, like be glad that you're in the group of women that know they have it. Right.
Yeah.
It's millions and millions of women that have prolapse, never heard of it, don't know what it is, and could be making it worse. So number one is like, listen, be thankful that you have the knowledge, that you were exposed to platforms or doctors or whoever that put you in the know. And then the next thing I would say is remember you're not alone. Like remember the numbers of that means it's more than 1 billion women living with prolapse if it's half of women that have had a baby, right? So that's the one thing. And then the other thing I would say is like focus on what your body can do and what your body does well and capitalize on that. Because we all gonna have our flaws. Like we
Right.
all will have the things that we're not too happy about. But there's one thing that you can do well. Focus on that, like continue exploring your body and get support. Like don't feel like you have to manage it alone.
So I grew up watching The Cosby Show, right?
Yeah.
And one of my favorite episodes of The Cosby Show is when Bill Cosby and his wife realize Theo is dyslexic.
Okay.
And so in that episode, they had, because they were trying to figure out what's wrong with Theo. Like he going to school and he's not making good grades. Like what's wrong with my son, right? And so they got him tested, and he was dyslexic, and they were like ecstatic, like, oh my God, he got dyslexia, right? And
Is that what you thought of when I did that?
yes, and in the show, and Theo's like, well, I've got dyslexic. Like, why y'all so happy? He was like, 'cause son, now we know how to fix it.
Exactly.
Right? And I was like, yes, if you don't know what it is, then you can't fix it.
Correct.
So knowing that this is what I have, there's a name for it, there are treatment options, I can fix it. So knowing it is half the battle, because now you know what you got and you can fix it.
Exactly. And there's treatment. It's not like we're like, hey, there's absolutely no treatment. There's nothing you can do. So I'm with you if you're frustrated. Like we have all been there. But like you said, like you know what to do now. If you're listening to this episode, you know what to do. You're not alone and there's treatment available.
Yes. So, Dr. Janelle, so how can people find you? Where are you? Where's your office located? Are you in Texas? Where are you at?
I just moved to Alabama. I used to be in Chicago. Yeah,
Chicago.
I was
Okay.
in Chicago. I just moved back home to Alabama. But my practice is completely telehealth. So we focus completely on sexual pain, though, and making sure that sex is pain free and easy and all of that. But I do have a directory that I started with other women of color pelvic floor therapists. And I think it would be good for me to mention that just because it's not that we can't treat prolapse, but a lot of what we do is focusing on sexual wellness and like making sure that you're not having pain.
So how can people get to
The
you,
director.
and how can they get to directory?
Sure.
Yes.
To get to me, I'm on Instagram at Vagina Rehab Doctor. And then if you want to learn more about our services, my website, vaginarehabdoctor.com, www.vaginarehabdoctor.com, everything is spelled out. That is where you can find our services, but also the directory as well. So the directory is on that website under the tab that says resources. And so that's where you can find some women of color pelvic floor therapists. We have therapists all over the country and even outside of the country. So like in parts of Africa and the Caribbean and Canada. So that's a great resource. And if sex is painful, then we're your people. Or if you have vaginismus and insertion is not possible,
These are
then
people.
we're here for you as well. So yeah, that's how you can learn more.
Thank you, Janelle, for coming on and explaining what that is. So now people cannot be so like, oh my God, what is this? I'm going like, what's this happening? What's this thing that's going to happen to me? So now hopefully we have a little bit more information and we can be better prepared for when life changes.
Amen. Thanks for having me.